It is important to be clear about something up front, though. EMF sensitivity is not usually a diagnosis, but it's also not a statement about danger or fear. This is a description of how a person really is individually responding to the environmental load of the modern world, particularly with an already stressed, inflamed, or depleted nervous system. Talk about modern health challenges, there's one factor that almost everyone is exposed to, and yet very few people are taught how to think about it clinically. And that factor is electromagnetic exposure, or EMFs. Things all around us, right? Wi-Fi, cell phones, Bluetooth, smart meters, wearable health technology, power infrastructure, right? That just gives us the energy we need. EMFs are now a constant part of daily life. And for most people, the body adapts reasonably well. But for a subset of clients, the adaptation doesn't happen smoothly. And today's training is all about what to do for those individuals, for people who are EMF sensitive. And it talks about how to recognize when environmental exposure may be interfering with healing, with recovery, or with nervous system regulation. Now, one of the challenges with EMF sensitivity is that it doesn't show up neatly on a lab report. Most clients don't walk in saying, hey, I'm sensitive to electromagnetic fields. Instead, they present with patterns, right? Symptoms that worsen at night. Poor sleep despite exhaustion, headaches, agitation, brain fog, heightened nervous system reactivity, and inconsistent response to what would otherwise normally be a supportive therapy. Often these clients are doing many things right. They're eating well, they're hydrating well, they're resting, they're using gentle modalities already, but their progress stalls or fails to hold. And this is where EMF sensitivity deserves very thoughtful consideration. It is important to be clear about something up front, though. Okay, EMF sensitivity is not usually a diagnosis, but it's also not a statement about danger or fear. This is a description of how a person really is individually responding to the environmental load of the modern world, particularly with an already stressed, inflamed, or depleted nervous system. So sensitivity here doesn't mean weakness. It often means the system has lost some of its buffering capacity. And from a physiological perspective, the body is an electrical system. Nerves fire electrically. Cells communicate through electrical gradients. The autonomic nervous system relies on precise signaling. And when those systems become overloaded, when they become dysregulated, additional environmental input, including EMFs, can just become harder to tolerate. And in these cases, the body doesn't necessarily break down. It compensates, often by staying in a guarded reactive state. And this is why EMF sensitivity often overlaps with things like pain syndromes and autoimmune issues, chronic stress, burnout, trauma, nervous system dysregulation, all of these things. So as we go through this training, I'm going to show you the physical protocol approach that we take with patients who are EMF sensitive, and you will be able to apply this to your own clinical practice as well. Okay. So I do have a slide to share on the elimination assistance, which I will do at the end. But let's start here. Okay, first and foremost, what we're looking to do with EMF sensitivity is typically not to treat the EMF sensitivity. We're looking to actually treat an underlying condition. And we're trying to make sure that our protocols don't cause issues for people. So because of an EMF sensitive patient's issues with electricity, with electromagnetic fields, we want to be extra careful here. So we're going to recommend taking it slowly by working on the body of the patient and getting them used to the current before diving into anything more complex. So the best starting point for us is going to be gentle things. Vagus nerve stimulation is the first. This is far and away one of the most powerful and profound treatments you can do with your device for anything. It is very, very important. If all you ever did with your device was this, it would be worth it for that alone. And this protocol, you can often find several videos of me demonstrating it, but this is absolutely necessary for decreasing inflammation in the body. And when inflammation is present, it is for most people, healing can't occur. And so this is why this is so important. And it's great for decreasing stress. All in all, I can say that this protocol should be very easy to start with, and it should make very good progress, even for those with EMF sensitivity. I have had a few patients who have done vagus nerve just once or twice and have actually gotten rid of their latent EMF sensitivity. Now, this is great. This is something that you want to be able to do. Now, again, you can find videos of this, so I won't demo this one in depth, especially as practitioners. You should know vagus nerve stimulation, but you're going to be looking on the left side of the neck for the carotid artery. You're going to be placing your Y probe just behind it, and you're going to be running 7 to 12 hertz for 3 to 4 minutes on your patient. If you can do that multiple times a day, great. Maybe you do a longer session for them. But this is a good way to get started. The other thing that works really well is the grounding protocol. Now, this can be done to essentially help the body to reduce the electrical chaos. And in doing this, you're going to be applying either the gloves or socks or some sticky pads to your hands and feet, to your patient's hands and feet, and you're going to be running 7 to 12 hertz. Again, right? See, it's a nice low-level EMF-friendly frequency. And this will really, really help to decrease the chaotic energy in the tissues. It grounds the cells. It has an effect similar to walking in the woods in the dirt, right, with bare feet, which is a thing that can help with EMF sensitivity. So this is a great, great option as well. Now, onto the stuff that actually is a little bit out of the box from our normal protocols. This first one is going to be what we call our discharging EMFs. And this is really actually discharging the thyroid. The thyroid seems to act as a sponge and absorb electromagnetic fields, and then it can throw off your hormone balance and cause all sorts of problems. So, 2 to 3 times per week, we recommend a very simple process involving dosing over your C7 vertebrae or your patient's C7 vertebrae. So this is not going to be the front. This is the back. Okay. So you find your C7, you are going to place your device on it, and you're going to simply take it to a dose. Now, if you have an evolution, this is going to be 60 hertz. If you have a Pinnacle Light, this is going to be Blue Rel X 77 hertz. And then it's going to be 77 hertz in the Genesis 2, or assess 60 hertz in the Pinnacle. And you're going to essentially, you can use the built-in electrode or a Y probe or any electrode, place it on the C7, increase the power until you can feel it, and then you are going to wait for that dose. Now remember, the dose on the Evolution and the Genesis 2 is a blue light coming on, and it is a D showing up on the screen in the Pinnacle Light and Pinnacle. Once this dose has happened, we are then just going to move on. That's all we're going to be doing. It's to try and discharge buildup in that thyroid area of EMFs. And so doing this 2 to 3 times a week is a great option. EMFs, I've mentioned this before, they tend to stick on or in the thyroid. And so this is a great way to help to decrease that EMF sensitivity and allow the body to freely flow. Now, the complicated protocol, if you want to call it that. This is elimination assistance, and this is often the go-to protocol for any time that we're trying to treat EMF sensitivity, but also latent viruses, mold toxicity, other things. Now, this protocol by itself is not working to get rid of the EMS from these areas. It's working to open up these detox pathways in your body by working on these specific meridian points that are the front mu points. Okay. So this treatment can be used with any of our devices. You can use either 77 hertz or SanaSoft T. So Pinnacle Light and Pinnacle owners are going to use SanaSoft T. If you are an Evolution or Genesis 2 owner, you're going to use 77 hertz. So you're going to set your device to that mode and adjust the power to a comfortable level. And using an attachment suitable for painting, Y probe is probably the best one, or the massager, you're going to work over the alarm point. And you're going to start at the top, below the neck. We don't bother with the face ones. And you're going to start working on painting those areas out. You look for active zones. That's the key here. But if you can't find them, if it's just smooth, then you just do 20 to 30 seconds and move on, okay? So what you're going to be doing here is finding these active zones. So you would start, for example, with the triple warmer here. And then you would move to your lung meridian points here. And then you would move to the circulation one here, and then the heart one, and then the liver. And you see the process here, right? You're working over these. And if you find active zones, you're making sure you spend a few minutes getting rid of those active zones. If you look at the body as you're doing this and you see that an area is starting to become red with white areas dotted in it, you need to switch to fMRSI because this is degeneration that we're seeing in the tissue, and you want to give it some extra energy. So what you're going to be doing here is doing all of these points, and then the body is essentially ready for detox. Now, this does not mean that you are going to detox, okay? I think that's the important piece here. People often think of this as, this is scary, I'm going to get a detox reaction. That is not the case for sure. We do say that you can do elimination assistance daily. Obviously, if you're working on a patient, you might not have access to them daily, but a few times a week is totally fine. And I think as far as the points go, it's going to be dependent on how active those zones are versus not, right? If they're not active, it could be 30 seconds, it could be 2 to 3 minutes for another. But the goal here is to do this sort of protocol set for a week or two and then see how the patient feels. The goal is to really stop us causing problems by adding energy into a body that is rejecting energy. And so by doing these protocols, we open up the tissue and we allow the body to function better. So this is what we would do for our patients. This is what we do with all of our clients. And this is what you should be doing with your patients as well. So thank you everyone for joining me. Hopefully you found this an interesting protocol video, and it's going to help you with any EMF sensitivity clients that you see. I will throw in here that this used to be something that I saw very rarely, but I certainly see it more commonly now. More people have become EMF sensitive since COVID, and there's been some pretty big surges as 5G moves to 6G. Also, EMF sensitivity tends to impact people that have latent viruses or mold sensitivity more than it does others. So there's a lot of overlap here that we have to be aware of, but you can absolutely get some success from using these protocols to prime the body so you can actually do the treatments you want to do. Okay. So again, thanks everyone for joining me. Take care, and I'll see you next week for another 10-minute training. Bye-bye.